Are you tired of all the tension in your life? Well, I know your head certainly is, and that's why many suffer with tension headaches. My name is Dr. Darby Campbell, and I'm going to be going into what's actually causing these tension headaches so that we can deal with the root cause and heal and recover naturally. Because tension headaches aren't a result of a deficiency in Tylenol or aspirin or any other drug for that matter. And so let's actually deal with what our body, the cause of this tension, so our body can heal. And so what is a tension headache? Well, it's commonly a pressure or a tension felt at the base of the skull, around the sides, or in the forehead. Most commonly, this is a very symmetrical pain and tension feel. And it's caused by, just like what it sounds, myofascial tension in and around our head and neck. And so myo is just like the muscle, and fascial is just the connective tissues in and around our kind of scalp, head, and neck. These are very classically stress related. So when we get into kind of stressful events, our body gets tense and guarded. And if we are in that chronic stress all the time, we get very defensive and guarded, and this posture tends to irritate the nerves. And it tends to build that tension headache over time if we don't start to deal with how we're handling our mental stress. So a really easy tool to help with this one, and easy yet very, very powerful, is this simple breathing. Breathing can calm the body down a lot. And so when we're in the middle of that tense situation at work or with a relationship, we can just kind of stop, calm down, take a couple deep, slow breaths. Just in the nose, out the mouth, very calm. Try to really lengthen that exhale. And then as we exhale, just try to relax those shoulders and just let them fall. No matter what situation you're in, this is a technique that can really decrease tension in our bodies. Of course, we want to be setting up kind of healthy boundaries and how we're actually dealing with the stress instead of letting it take such a physical toll on our bodies as well too. Next one, posture. The postures we assume, this is also related to stress as well too. If we get chronic stress all the time, we get very in a defensive, survival-based postures. Think like a person guarding, either protecting themselves or getting ready for a fight. We're going to assume a defensive posture. And so these two are linked. But then also just the amount of technology we're looking at today. And so we're always looking down at our phones, our tablets, computers, driving cars, looking at screens. This gets us into a very hunched over posture. And what this is doing to our lower neck is as our head travels forward with the effect of physics and levers, we increase the weight on our head. So just let's think about a seesaw here. And so if our head weighs around 10 pounds, simple math will just keep it around 10, it varies between 10 and 14. For every inch it travels forward, it creates an effective extra 10 pounds of force. And so for 1 inch, we're now 20 pounds. For 2 inches forward, we're now at 30 pounds. For 3 inches forward, we're now at 40 pounds. In our clinical practice, we see between 2 and 3 inches most commonly when people start our care. And so that's an effective extra weight of 40 pounds because we shifted our center of mass forward. If you put 40 pounds on a seesaw in a playground, what's going to happen? It's going to go straight to the ground. But we're not falling to a heap on the ground all the time. And so what's holding us back? Well, it's the muscles of our back and neck. And if we are 40 pounds over here, we have to balance that with 40 pounds of tension on the other side. What does that do to our lower neck? It changes the 10 pounds of effective weight to 80 pounds. 80 pounds of effective weight on our lower neck that's designed to handle 10 to 14. This is why we're seeing spinal arthritis in 10-year-olds, because our spine is breaking down at a greatly accelerated rate due to the postures we're assuming looking at these devices and doing our daily life. And this is the common cause of a lot of tension headaches because our bodies aren't meant to handle this amount of tension all the time. And that's going to commonly create a tension headache. So we have to be correcting this to save our spines for long-term health. At the actual spinal level, it looks like this. So Clarence, he has a pretty good spine right now. The head is balanced over the spine. You kind of see how it's straight up and down here. But when we get hunched forward, all that force builds right here in your lower neck, and that's the common source of that tension up into the head and the upper back. And so what this does actually as well too is this creates misalignments in these bones of the neck, and that's called a subluxation. So posture is how your global spinal alignment is. Subluxations are each bone on top of each other, how they're aligned. When we get into a bad posture, we will commonly create subluxations or misalignments of the spine. This creates a nerve pressure, irritation, and then the real kicker is when we have these subluxations, we want to get into the good posture because we know it's the right thing to do, but our spines can't do it because the bones are now misaligned and they can't assume that normal, healthy posture again, no matter how hard we try to sit or stand up straight. And so we have to be dealing with these in combination. And the only way to do these is by going to see a chiropractor and getting this checked and adjusted. A next common cause of tension is this simple dehydration. When tissues dehydrate, they get tense and tight. And if we are chronically dehydrated, that tension can build and create a tension headache. So we gotta be making sure we're staying hydrated. The next one would be magnesium. When muscles are deficient in magnesium, they tense and they get very, very tight. Magnesium is involved in muscle contraction and relaxation. And when we're deficient in magnesium, we get very tight. This is why Epsom salt baths relax us, because there's magnesium in that. And so when we choose to supplement with magnesium or add magnesium in through Epsom salts, we can relax chronic tension and help with stress and a couple other things as well too. But that's going to help just that tension headache ease. Magnesium is also involved in pain electrical signaling. And so when we're deficient in magnesium, those electrical signals get hairy and we tend to start creating them all the time, and that creates muscle tension as well too. A couple other more relief measures would be massage. We love massage, and that's going to help decrease the tension and decrease the headaches. But I call it relief because if we're not dealing with the source of that muscle tension through kind of the magnesium dehydration or the posture or kind of subluxations, they can be very relief oriented. I still love massage and it's very, very good, but it's good, and it's going to actually help correct these faster as well too, but we have to be dealing with causing that tension. And then people always forget about self-massage. Self-massage gives your body biofeedback, which helps learn new muscle kind of tension patterns and let your body know when it's too tight. So self-massage combined with breathing can help the muscles calm down a ton. Another really popular one is peppermint. This massaging peppermint essential oils into the temple can help almost, in some cases, this ease that headache pretty quickly and give you kind of relief so you can do some of these other measures and deal with the root cause. My name is Dr. Darby Campbell, and I'm at Campbell Chiropractic.